Welcome to Pathophysiology. We're going to be going through Unit 1. This is going to be a long one. We're going to get through it. So, Chapter 1 is Introduction to Pathophysiology. Starts first page of your book. That's kind of where we're going here. So, basically, the conversation is, what is pathophysiology? And really got to look at the root word itself. Like think about medical terminology. The ology, ology, ology is always the study of something, right? Physiology, if you go back to anatomy and physiology, anatomy is like kind of the study of what an organ is, what a tissue is, what does it look like, where is it. The physiology part of anatomy and physiology is how does that organ or tissue function? What does it do? How does it work? And so physiology, the study of how the body functions. Patho, the word Patho, patho refers to disease or disease process. So when you think patho, think disease process with a P, patho, P. Pathophysiology is then the study of how diseases affect the function of organs, tissues, and the body, etc. So that's what pathophysiology is, the study of the functional physiological changes that organs or tissues take place in the body. So disease development, names and things associated with it, and basically pathophysiology combines the physiology part of A&P with the uh, the patho, this disease process part of studying diseases, pathology. It's a combination of the two. So one big word to always keep in mind is homeostasis. Homeostasis is just understanding the body is always in a cycle, a balancing act of things happening from outside the body, um, whatever it is to keep you stable. So if I get cold, if I go outside right now when it's cold, what happens? I start shivering, right? I'm shivering because my body is trying to correct my declining or dropping body temperature by making my muscles shiver and spasm and move and generate heat and then thus bring my body temperature back up. That's what homeostasis is. It's the cycle of trying to oppose actions from the outside world or actions from internal. It can be stuff, external factors. It can be internal factors in the body, like a disease that mess up homeostasis. The body tries to correct that. But the goal for homeostasis is you should always hear that word and think body's balance. The body's equilibrium would be another synonym for balance. The body's balance. Okay. A state in which the thing with patho or disease is basically disrupting the body's homeostasis or making it hard for the body to maintain homeostasis. And therefore, you have an instance of disease. So, health and disease are not just kind of minimal, they can kind of be all over the place. When you talk about health in general is three things really: it's physical, the mechanical part of our body, our brain and mental well being, and then obviously social. We think about things like the uptake in depression and other diseases during COVID when isolation was happening. That was a very social impact on health. And then disease in general is that patho word is just any deviation from normal homeostasis will be categorized as disease. So we have diseases that are infection, diseases that are internal, like autoimmune diseases, disrupting normal homeostasis processes in the body. So health indicators, when you think about health, there's stuff we can't really adjust, age, gender, genetics, but things we can adjust: environment, activity level. Normal values are always going to be different. So I always tell people you can't treat a number or a value. You have to treat a patient and the whole thing, what's going on with them emotionally, socially, and physically, because emotion can raise blood pressure, can raise heart rate, things like that. You have to look at the patient as a whole. So if someone says, hey, we need to treat this patient's blood pressure, it's really high, but that patient's also in extreme pain, well, maybe we should target the pain and it might correct the blood pressure. So it's a holistic look at a patient, not just a number. And this book talks about, too, in the first page about health. These are basic things to guide every patient in proper health: avoid smoking, proper fruits and vegetables, physical activity, protecting themselves from UV radiation, the sun, regular screenings, doctor visits, and then overall following health and safety, avoid jumping off a roof into a pool, that course sort of stuff. Preventing disease is working to be the primary focus of healthcare. For a long time, the focus of healthcare was treating disease, but we need to move to prevention. So different things of doing that, regular doctor visits, promoting community health, other programs like that. And again, doing video lectures, I'll be going kind of fast. If there's stuff that you need more in depth on, that's what we'll spend time on in class. When it comes to health and history, again, taking the whole patient into account, you have to take a good medical history to kind of think about disease processes. And when we talk about pathophysiology and understanding disease process for nurses, for doctors, for anybody in healthcare, understanding disease is really, we talk about the word diagnosis, but really to get to that point is a full assessment of everything, of those big threes, physical, mental, and social health, and how that relates to a lot of this stuff on this slide. Their allergies, other illnesses, have they been hospitalized, what treatments have they had, and especially drug therapy. Drugs can do a lot to change someone's health, and so it's really a detective work of putting this all together for someone to get a diagnosis of disease. So first question is, what is homeostasis referred to in the context of health? I'll let you pause the video here if you want to answer this question. I'm not okay. So after you pause it, the answer would be a maintenance of stable internal environment. So think of internal environment as the body. The body's response to external stressors is not so much that homeostasis is the body's balance, regardless of what's happening outside necessarily. It may be something outside, it may be something internal that's causing a problem, but it's the internal environment of the body that homeostasis is trying to keep this loop, this circle, basically keep it stable. So if you kind of think of homeostasis in general as this loop, basically, we want to maintain it. So I'm gonna run out of room. I didn't start drawing, but homeostasis is in the middle here. It's all about getting back to it, or you could think of it better as like a teeter totter, right? It was homeostasis in the middle. So if something pulls the balance this way, this end goes down, right? Well, then the body's going to come with something to correct it, to balance it out. Same thing the other way. That's homeostasis, this constant balancing act. So the answer is number 4. Moving on. Disease process. So some words that talk about disease process in your book. I believe this starts this conversation, sort of kicks off in the terms of pathophysiology, but mostly around page 6 and 7. So diagnosis, again, is that kind of what would be the right word? Diagnosis would be the identification of a disease. So this is the detective work, understanding. So this is evaluating signs and symptoms, evaluating hard and fast numbers for data on a lab test, those kind of things. So diagnosis is basically identifying the disease itself, identification, the detective work. Etiology would be what causative factors play a role in this disease. So say again, the disease, I have plaque psoriasis as a skin disorder, an autoimmune disorder. So I have plaque psoriasis. So that's the diagnosis based on my symptoms and lab tests, right? What is the etiology of my psoriasis? Well, generally most autoimmune disorders are unknown, so I guess that wasn't the best example. But etiology would be what's causing my psoriasis. So things that they know about psoriasis is stress can make it flare up. It's a genetic component, so you get it carried over from your parents. When we talk about phenotypes and alleles, from parents come over and can cause disease. So I would have got this down from my mother, actually. And so it's an inherited condition, autoimmune. So what's in the body is messing with the homeostasis that's causing causative factors to this disease. That's etiology. Diagnosis is what is the disease and how do we figure that out, the detective work. So other things to talk about disease, like causes, what's causing it, etiology. Again, causes of disease will be, these are the types of etiology. What are the type of reasoning? So one etiology is idiopathic, means it's kind of unknown. A lot of autoimmune that affect our immune system causing issues are unknown. They have identified some causes to it or predictors for the disease, but overall, as far as the one true thing, a lot of those diseases are idiopathic or unknown. Or if it's completely unknown, it would fall under idiopathic. Diseases that are caused by treatments that we do. So if I'm someone in surgery and they get a glove left in them when they get stitched up and they get an infection based on the surgical glove left inside their abdomen or whatever, that would be an iatrogenic cause of disease. Something was an error, a treatment caused and things like predisposing factors that cause diseases kind of fall in line with leading to age, gender, inherited factors. So my psoriasis is autoimmune. We know that. So it's more about predisposing factors that make me have the disease, not necessarily just pure idiopathic. Pure idiopathic would be a kind of complete unknown cause. Prophylaxis is a word when we talk about disease process. It means that we're trying to prevent the disease, prevent the spread of disease, prevent disease from happening. Example, prophylaxis is a patient would take a baby aspirin to prevent a heart attack, help keep clots from forming. But also prophylaxis is with antibiotics, and actually in hospital settings for big orthopedic surgeries like replacements of hips, knees, shoulders, they'll do antibiotic prophylaxis for patients that might be more at risk for infection, and that means before. So I'll give a antibiotic before the surgery and even after, even though there's no infection, just to prevent one from happening, because the risk of infection is high in those procedures, and that falls into sort of in prevention. But prophylaxis means entirely we're targeting a specific disease, or it means that a little bit not, excuse me, prophylaxis is very generic and non-targeting. Like overall, we're doing something to prevent health. Like prophylactically, I could exercise to prevent health associated diseases that are associated with obesity or poor physical health, like diabetes, type 2, those kind of things. That would be prophylactic on my part. Prevention would be me getting a vaccine for the flu. Changing lifestyle modifications, that sort of stuff. That's prevention. Oh, I just kind of totally mixed that up. Sorry. That's prevention. Prophylaxis, prevention are very similar. I think your best way of probably putting it into context, if you want to think about it, would be prophylaxis is a very specific measure designed to prevent the spread of disease. Spread of disease is the key there. Prevention is more linked to the predisposing factors and how do we stop this disease. So lifestyle measures, vaccines, diet, or taking stuff out of the environment to prevent a disease, where prophylaxis is we're going to give you something to prevent disease, where prevention is more in line with overall health, I guess would be the best way to think of that. So going further, characteristics of disease is talked about still in these pages 6 and 7 have a lot of this information. Pathogenesis means the disease is developing, and then onset of disease can be acute or what they know as insidious, which is like gradual, very vague symptoms. A lot of autoimmune diseases are very insidious, very vague symptoms, and they can differ between genders and ethnicities and background. I think the need to know here to hone in on is the acute disease versus chronic disease. So really want to know that. So acute disease is a short term, happens very quickly. This could be severe pains, high fever from a very acute infection that you can resolve quickly. Chronic disease is much more gradual, kind of in the vein of insidious, develops gradually over months, years, milder symptoms. Often the symptoms are intermittent with acute episodes that a lot of times they'll call the acute episodes of a chronic disease, exacerbations of a disease. So a big one for this is COPD. It's in the name, chronic obstructive pulmonary disease or disorder. COPD, it typically is a chronic disease, and it happens over time from smokers or people that have been exposed to things that are harmful to lungs, working in factories or coal mines, things like that. Not all COPDers are smokers necessarily, but that would be a chronic disease and a gradual onset intermittent symptoms. That would be the difference between that and acute. And so it talks about some of these other characteristics of disease. that you can get a little bit in the water. So I think they definitely need to know acute versus chronic. I think that's a good place to stay. So a latent stage, sometimes it's called a silent stage that the book notes. It sometimes refers to um, incubation periods, that sort of stuff. So normally what is involved in silent or latent stage is that there's no clinical signs or symptoms of a disease. Um, but sometimes that's because it's an incubation phase. So maybe I got sneezed on and I got a flu virus, but I have no symptoms yet. That could be a latent state of influenza A or B or whatever, until I show symptoms, and then I would be in a what they were referred to more of a prodromal period or prodromal state is a development of the disease. And now I have some signs that are maybe non-specific, a runny nose, that sort of stuff, headache. And then it blows into manifestations, which would be full on signs and symptoms, irritation, swelling, those kind of things. And so that's like the disease progression that they're outlining there. Latent is I've got it and I'm not latent state, and I'm not you know uh having any symptoms, but I could still spread it. Sometimes contagious diseases can be spread in latent states. And then prodromal is like the beginning of manifestations, beginning of some symptoms. And then when you have a fever and you're full on stuffy nose and have green mucus from a cold, that would be manifestation, signs and symptoms. I hope that kind of makes sense. So again, same vein, we're still talking about characteristics of disease. Signs and symptoms are part of that manifestations of a disease. And then other manifestations that come into that could be things like lesions, which are, wounds or chain. Basically, lesion is a word they use, broad spectrum word. Lesions is to just define anything that is local change in tissue. So that could be a wound, inflammation, any change in tissue you would think of as a lesion. And a syndrome would be more like a collection of these signs and symptoms. So I look at signs and symptoms falling into the category of manifestations, but signs are more, if you want to make the difference between signs and symptoms, the way to define them, a lot of definitions in this first one, but signs would be more of objective indicators and symptoms would be more of subjective feelings, right? So if you think of signs and symptoms, you go to that. Signs is more of a, I have a high temperature, like I can check that. I have a runny nose. Symptoms are more like I feel tired and I don't feel right and that sort of stuff. That's more symptoms. And then lesions or change of tissue. Syndrome would be a full collection of signs and symptoms that affect more than one organ. And so that would be called some kind of syndrome. And they have a lot of diseases that can progress to certain syndromes. And then obviously diagnostic tests are tests to help us diagnose, which means they're tests that are helping try to indicate and do that detective work on what the disease might be. So other characteristics of disease to highlight between page 6 and 7 is remissions and exacerbations, those kind of things. Remissions would mean a disease that's usually chronic in this case, or has a course, is kind of not showing symptoms or that sort of thing, where exacerbations would be a sudden kind of worsening of the severity of the disease. So worsening of the severity of signs and symptoms would be what it is. Precipitating factor is anything that might can trigger an acute episode. The book gives the example of something that triggers a seizure. So if that's flashing lights or something like that, or an asthma attack or something with respiratory on a cold day would be a precipitating factor. And then complications from a disease really go into new developments from a certain disease. So you may have these signs and symptoms and these things, diagnostic tests all come back for disease, while other things become developed from a certain disease. Complications like, I had a tumor pushing somewhere. Well, we removed the tumor, but the tumor caused damage to tissue around it, and maybe that caused some bleeding, not from the tumor or not from a surgery, but the bleeding was caused by damage from the tumor. That would be a complication of said tumor. So disease prognosis is the next kind of step on page 7 on your book, and it goes into prognosis defines, basically, this is a good definition. There's a lot of note cards I would think you need for chapter 1, and a thing with note cards, I'll say, or things like I'm blanking on the note card name for the online note card. You guys, Quizlet. So things like Quizlet and stuff like that are good. The thing I'll tell you with note cards, you can't do all your studying on note cards. You'll miss some understanding of big concepts. Things like in chapter 1 is a lot of definitions. And I also encourage you guys to do things like mind mapping, which we can look at. But what mind mapping will show you is, and we'll look at some mind mapping together. But mind mapping is basically, if I go back to a slide that's a little more open. Let's see, actually, let's do this. Stay with me there. You know, okay. So I'll look at it. What mind mapping would basically be saying is, if I can try and show this as best I can here. Mind mapping would be basically saying, I'm going to put a subject in the middle here. So what if we put like disease development, right? So then I might put something like, pathogenesis here in the middle. That's development of a disease, and then mapping the subject matter around what is pathogenesis. So you have acute, right? Or a pathogenesis can be chronic. And what's the difference between these two? And write you something about that. Right over here, you could have some subcategories, or you can have things attached to acute, like subcategories attached to certain subjects. But you could do over here like latent state, what is that, things like that. So I hope that makes sense with mind mapping. We'll do some of that in this class. I think it's helpful, but that's some other ways to study. You don't always want to be honed in on just like flashcards and memorizing definitions, but there's a lot of definitions in chapter 1, so flashcards can be helpful for definitions. So disease prognosis defines basically the probability or likelihood of recovery from outcomes. So you would say good or bad kind of in this scale, but a good prognosis would be probably evident that you're going to be fine after the disease runs its course of action, like a flu usually, or something like that. Something like a very cancer that spreads rapidly, or cancer that's known to be deadly, could have a poor prognosis based on some factors they talk about with tumors and cancer. We'll talk a little bit about in chapter 20, but disease prognosis is basically saying, how likely am I going to survive this disease progression? And with most diseases, it can be good. And then obviously with things like cancer and other diseases, it would be not so good. And that would be a poor prognosis. So really prognosis comes to poor or good, and it's just the probability of likelihood of surviving the disease process. Some other words that go into disease prognosis that kind of go under that. Again, if you were to define this in a mind mapping technique, you would do disease prognosis in the middle, define it, and then attach these terms to prognosis. So morbidity, as a summary, basically is saying the disease rates in a group. So if I had 100 people in Nashville, Tennessee, and 20 of them of the 100 got the flu this year, the morbidity for that flu in my sample size is 20%. That's the disease rate in that group. Mortality, on the other hand, is a word that kind of highlights our mortal being, that we can die. Mortality says the number of deaths resulting from a particular disease. So of that 20% that got the flu in my morbidity number, the mortality number would be how many people of the 20 died as a result from that particular disease. Now I'm just using the flu because it's very common. We all know what the flu is, but just using an example, the mortality rate, if say 5 out of the 20 died, right? Then or let's just do an easier number. Say 10 out of that 20 that were morbid, right? That morbidly we get processed got the disease. If 10 out of 20, then 50% mortality rate for that flu virus would be what you would be saying. So mortality is about the number of deaths. Morbidity is about the number of disease in a particular group. And then some other terms, autopsy, most of us heard that. That is just a post-mortem, a post-death examination of why someone died. That's what an autopsy is. And another word, epidemiology. Again, there's an ology there. So OLOGY is a study of something, study of epidemia, epidemia, or in another term, epidemics. Epidemiology is basically studying or a science about tracking the occurrence or patterns of a certain disease. So if I'm a scientist studying morbidity and mortality rates of the flu in Nashville, then I'm doing an epidemiological study. I'm studying the rate or occurrence of a disease. So other things with disease and prognosis, some other terms. Occurrence, again, has some sub definitions. Occurrence is basically talking about, does a disease progress? And so occurrence is basically incidence, number of new cases, and then prevalence is number of any existing cases. So incidence is basically saying, as far as how does disease, occur, incidence is saying, hey, the number of new cases in this given population has gone up or down, whatever, in this time period. Prevalence is saying in this same time period, how many new, old, just cases of the disease are there? That's the prevalence. So epidemics and pandemic, you've heard this word, you've probably heard pandemic float around a lot during COVID, but epidemics basically is a high number of expected cases of an infectious disease within a certain area. Pandemic is a high number of infectious diseases in many regions around the world, basically. So if Nashville has a higher than expected infection rate of flu, that could be labeled an epidemic. But if there's a higher number of flu across the country and in Canada and Mexico and other regions of the world, that could be considered or classified as a pandemic, which is what COVID was. Also in this to note is communicable diseases. Communicable basically is saying they can be communicated to other people. So communicable disease is another word that is just a synonym to that, is infectious diseases spread one person to another. So any disease that can be spread from you to me is considered a communicable disease. And then we have diseases that are what's called notifiable or reportable. These are any diseases that are very contagious, and are usually diseases that have been eradicated by vaccines for sure, or not common in certain regions of the world. So tuberculosis is not common in this part of the world, but same time we have vaccines for measles, mumps, rubella, MMR vaccine. So if there's a case of measles, that should be likely reportable or notifiable to keep track of that. And so that person that is a studier of disease occurrence, epidemiologists, can follow up and keep track of that. So another question that's a little bit challenging. What does or not challenging, but another question to kind of rehash what we learned. What does the term morbidity refer to in disease prognosis? Morbidity. So I'll let you pause the video and think about it. Okay. So we're back from the pause. What's the correct answer here? It's the incidence of disease, just how much of disease is happening. So some of these other ones are very close, but the likelihood of recovery, that definition will be prognosis. Number of deaths, that's the mortality rate. And the spread of disease is more in line with some of the other stuff we talked about, not so much morbidity. Morbidity is just how much disease were there. The spread of disease is more of talking about communicable diseases, incidence or prevalence, more likely. So definition of idiopathic. What is the definition of idiopathic? I'll give you a minute to pause the video. Okay. So correct answer for this is cause of disease is completely unknown. Disease is inherited, that would be what they would call congenital or genetic disorder. Disease that's caused by environmental factors. Disease caused by medical treatment. That was our other one that I'm just totally blanking on right now. But that was let's see, you guys got me. Introgenic, excuse me. Introgenic was caused by like a treatment. Environmental factors would be more like prevention of disease. Predisposing factors would be more like environmental. So cellular changes is kind of towards the end of this chapter, around page 9, or excuse me, page 8. And so cells are always changing. If you remember, cells, most cells in the body undergo mitosis to replace themselves, and that is mitosis is cell division. So the cell makes a copy of itself, right? And then creates 2 exact copies that are daughter cells. And so again, just the cell over here copies itself into 2 identical cells that carry all the same genetic information, and that's mitosis. And cells are always doing this. This is replication, right? They're always doing this, especially certain places that are roughed up a lot, like our skin and muscles. And so sometimes some modifications can happen to cells based on what tissue they are and their environment and the hormones involved. And so disease may develop when cell structure changes or doesn't function normally. And so some cellular adaptations are worth noting. Atrophy means that we're decreasing cell size. A big example of atrophy is actually someone who has muscle wasting. So someone that's bedbound, maybe they have paraplegia. They're don't have function of both their legs, and so they're bedbound, or they're chair bound and they can't get up. That person would likely have some muscle wasting from not using their legs. Muscles and bones typically be tissues that if you don't use them, you lose them. And so atrophy would be decreasing the cell size. A lot of times you'll see this in muscle, and the same thing you'll see with hypertrophy. Again, kind of going to words, hyper and hypo. If you see those prefixes, hyper, I always think of high and too much, like a hyper kid and too much sugar. Hyper is too much, high levels. Hypo, HYPO is too low and slow, too little of something, too not enough flow, that sort of stuff. So hypertrophy is too much, so that's increased size of cells. And this is usually in large tissue, and this would be like the bodybuilders have hypertrophy of their muscles. That's why they have such the big muscles, but it can also be other tissues. And then hyperplasia is increased number of cells, which can result in large tissues like hypertrophy, but usually in a more clumpy kind of mass. Hyperplasia would be. So not just like the size of the cells change, but just way more cells than there should be. That's hyperplasia. And again, some cases, the book notes that hypertrophy and hyperplasia can occur at the same time. It just sort of depends on the scenario. And this is the picture from the book on page 9. Normal cells, atrophy, there's hypertrophy, there's hyperplasia. So some of the other ones that they're noting here, dysplasia, metaplasia, and neoplasia. So dysplasia, it basically just means that cells vary in size and the nuclei are more there's more mitosis and cell division going on, so it kind of creates an erratic shape. Typically this can happen in skin or certain stuff like that, and this could lead to benign tumors. It kind of depends. A lot of times it will lead to inflammation and some tissue damage, and the reasons for this can be multifactorial, but this is a lot of what happens. For me, in the plaque psoriasis, the inflammation of the skin cells, they become erratic and ill-formed and don't stack like they're supposed to, and then it gets a lot of dry skin, stuff like that. That would be dysplasia. Metaplasia is just simply one mature cell is replaced with a different type of mature cell. So sometimes that can be our cells adapting to a certain environment. Like sometimes in COPD patients, they have the chronic lung disease, or they're smokers, especially smoking patients will have metaplasia, meaning that sometimes their lung cells replace with a different, stronger barrier of a cell, but maybe doesn't produce the mucus like it's supposed to, or a simpler cell that doesn't have the same functionality, and then the lungs lose some functionality, whether that's for, their elasticity, stuff like that. And then neoplasia, anytime you heard the neoplasia, is always like new growth, which typically can mean bad things. So neoplasia is commonly referred to as some kind of tumor. This is very close to dysplasia. And neoplasms or neoplasms will have benign or malignant, which we'll talk about in chapter 20. But benign means basically non-cancerous, but can damage surrounding tissues, and malignant means likely cancerous, likely to spread. But they can both present their own problems. Neoplasms and neoplasia are discussed more in chapter 20, but you hear neoplasm, think new growth, and we're talking about a tumor, and that's just talked about here on this slide as well. So cell damage is worth talking about. So some themes with cell damage. There is apoptosis, which is a normal cell programmed death. This is very common. Some cells have their DNA programmed to die at a certain point. Like our red blood cells don't have a nucleus, so when they're made, they have a cell death in about 120 days. They'll apoptosis, get recycled, and get the components reused. And then that's a little bit different than pyroptosis. That one's a tough one. Pyroptosis here at the end. Pyroptosis. Pyroptosis is basically the cell dying from an invasion or disruption of a microorganism. And so we'll talk about microorganisms more, but using that word, what you need to think of is mainly you're going to think of the common stuff. A microorganism is any virus, bacteria, but it also includes fungi, which is more uncommon, and protozoa, which is even more uncommon. Protozoa are basically, think of your things like tapeworms, ringworm. Protozoa are blanking. It's late at night when I'm filming this video. So microorganisms are bacteria, viruses, fungi, and protozoa. And we'll talk more about protozoa. Or starts with a P. You think parasites, basically, and so those cause pyroptosis, where they destroy cells. Other things to note: ischemia and hypoxia, very similar. But basically, the thing you can think of, ischemia is a decrease in supply of blood, of oxygenated blood to an organ, where hypoxia is reduce oxygen to a certain tissue. So most of the time you'll think of the differences when people talk about ischemia, they're talking more localized to a certain organ or a certain area. Tissue can be hypoxic, but overall people use hypoxia to refer to a more general lacking of oxygenation in certain areas. Very similar. Ischemia, you're going to see more of the tissue damage to an organ, and hypoxia can usually be resolved. It just means that the cells are demand for oxygen is up. And so that kind of covers the slide. So further on cell damage, it can be physical, mechanical, chemical. Physical would be obviously hot, cold. So touch a hot pan, frostbite in the subarctic, that sort of stuff, or radiation exposure. Sunburn, that'd be physical. That'd be categorically radiation. Mechanical, obviously gunshot, stab, that's mechanical damage to tissue and tearing. And then chemical could be something from the outside environment, but it could also be something, a hormone causing issues, a tumor releasing hormones that are causing stuff inside the body. And chemicals can be inside or outside, which is exogenous or endogenous. And let me highlight those prefixes if we're talking about medical terminology anyway. EXO is always like exiting or outside of something. So Exodus in the book of the Bible is where the Israelites or the Hebrews are being moved, or they're leaving Egypt. They're exiting Exodus. So they're leaving or outside. And then ENDO is like endoscopy. It's internal and inside the body, inside. So And then further on, cell damage again, microorganisms, bacteria, viruses, protozoa, fungi, abnormal things causing metabolism, genetic disorders, and then fluid shifts and loss of electrolyte imbalances. Those balances can cause cell damage. If they don't have enough water, they don't have enough of the electrolytes, the small molecules they need to complete actions, then that can cause cell damage. And so highlighting too is a word that's referred to at the top of page 10, necrosis. Necrosis is kind of similar to ischemia, hypoxia in the sense, but what necrosis is necrosis is what happens if ischemia or hypoxia weren't corrected. If we didn't correct the lack of oxygen to a tissue, the tissues and the cells themselves will die. And this is what necrosis is. Necrosis is the death or the dying of one or more cells in a portion of tissue or an organ as a result of just irreversible damage. It's not programmed cell death. It is result from damage, typically resulting from ischemia or hypoxia. And there's a picture of that here. And so this is kind of showing you to give you an idea. This is someone's foot. Again, death of one or more cells. But if you look kind of here, this tissue here, you can see the color difference in these areas here versus this area up here. That's why I like this picture. So this is necrosis for sure. It's necrotic tissue. It's dead. It's black, dark purple. Looks like it has no blood flow. You can see the purple edging all around. Now this tissue has a lot of pink to it up top. Okay, so a lot of pink up top, and it has areas of looks like blood flow, areas of yellow and orange, and otherwise this is healing, healthy tissue. You can see some scarring happening here and here. You don't see that here. This tissue turns black and it stays black, and there's nothing you do about it. So necrosis is cell death of tissue or cells, and what we have heard term probably debridement. Debridement is removing dead tissue so that you can have healthy tissue like this take back over and actually heal some area like that. So real quick, I'll do some of these questions and I'll let you guys pause it. I'm just going to cycle through them if you want to try and match these. And I'll let you pause it on your own. I'm just going to cycle through them. Okay, so we'll move on to chapter 20 next. That was first chapter, chapter 1. A lot of definitions. We're going to move on to neoplasms, neoplasia, basically, and cancer.